All right, we're gonna get started here. We're gonna first start with Epi-Pens. And I'm sure everybody knows that they do have stock Epi-Pens in the schools. I sent out yesterday some documents, and I'll resend it in a folder to make it a little easier for you to find, but it has all of the locations of where your NARCAN, your AEDs, your Epi-Pens are located, so please make sure you look at that to know where the locations are for your schools. There's also standing orders for each the NARCAN and the Epi-Pens. So you'll learn about how to use them today, but just you can review that. Every location does have a set of standing orders with the Epi-Pen and the NARCAN. There's also a list of the hypo and hyperglycemia signs for diabetes. So if you do have a diabetic, please review that. So we're going to start with a video, and I think Marcus is going to get that on there for us for Epi-Pens.
A life-threatening allergic reaction, anaphylaxis,
is unpredictable. It could be mild 1 minute, then suddenly...
It's scary, like you can't even breathe scary.
Or your skin gets all itchy and breaks out into hives scary.
or your throat starts to tickle and close scary. It's different for everybody.
Every reaction is different. A mild reaction one time can be life-threatening the next. So it's important to know your body and know when it starts to feel funny. It could be the warning signs of anaphylaxis.
So it's also important to know how to use one of these.
An Epi-Pen auto-injector.
Epi-Pen and Epi-Pen Junior are for the emergency treatment of life-threatening allergic reactions.
And for people who are at an increased risk for these reactions.
Epi-Pen and Epi-Pen Junior should only be used to help someone during an emergency.
Ready to show them how it's done?
Yeah,
Epi-Pen Junior, the one with the green label, is for kids.
like me.
An Epi-Pen with the yellow label for bigger people, like me.
Whether you need to use Epi-Pen on yourself or give it to someone else, you can just follow these simple steps. So first things first, you take it out of the tube.
Just flip open the yellow cap,
Or the green cap.
slide it out, and hold it like this.
Blue to the sky,
Orange to the thigh.
Then you take off the blue cap.
Blue safety release.
never put your hands near the orange tip because that's where the needle comes out.
The needle is designed to go through clothing, including jeans, because it must be injected into the outer thigh for quick absorption. If you're helping a young child,
Like me.
hold the leg firmly in place. Once it is,
You just do this.
Boom.
It clicks, so you know it worked. Then you hold it there for 3 seconds.
Then, remove Epi-Pen.
you'll still see some liquid in there, but don't worry, your Epi-Pen Junior auto-injector gave you the right dose, and it has a special feature, the never see needle.
Yeah, so the needle's totally covered up.
So you should never see the needle.
Then rub the spot for 10 seconds while you or someone else gets emergency medical help right away. Call an ambulance.
Or have someone take you to the emergency room. Just make sure to do it immediately.
And you should always carry 2 Epi-Pen auto-injectors wherever you go. They even come clipped together.
Because some people might need the second dose.
Take your expired or used Epi-Pen auto-injectors to your doctor's office and ask for a refill.
Remember, epinephrine is the only first-line treatment for anaphylaxis, not antihistamines.
So just trust yourself and do it. Don't hesitate, especially if you know the symptoms of a life-threatening allergic reaction and have practiced with the great trainer that comes in the box.
Because this is what's important to people like me.
And me.
Use Epi-Pen epinephrine injection USP 0.3 milligrams or Epi-Pen Junior epinephrine injection USP 0.15 milligrams auto-injectors right away when you have an allergic emergency, anaphylaxis. Get emergency medical help right away. You may need further medical attention. Only a healthcare professional should give additional doses of epinephrine if you need more than 2 injections for a single anaphylactic episode. Epi-Pen or Epi-Pen Junior should only be injected into the middle of your outer thigh, upper leg, through clothing if necessary. Do not inject into your veins, buttocks, fingers, toes, hands, or feet. Hold the leg of young children firmly in place before and during injection to prevent injuries. In case of accidental injection, please seek immediate medical treatment. Rarely, patients who have used Epi-Pen or Epi-Pen Junior may develop an infection at the injection site within a few days. Some of these infections can be serious. Call your healthcare professional right away if you have any of the following at an injection site: redness that does not go away, swelling, tenderness, or the area feels warm to the touch. Tell your healthcare professional about all of your medical conditions, especially if you have asthma, a history of depression, thyroid problems, Parkinson's disease, diabetes, high blood pressure or heart problems, have any other medical conditions, are pregnant or plan to become pregnant, or are breastfeeding or plan to breastfeed. Be sure to also tell your healthcare professional all the medicines you take, especially medicines for asthma. If you have certain medical conditions or take certain medicines, your condition may get worse or you may have longer-lasting side effects when you use Epi-Pen or Epi-Pen Junior. Common side effects include fast, irregular, or pounding heartbeat, sweating, nausea or vomiting, breathing problems, paleness, dizziness, weakness, shakiness, headache, feelings of overexcitement, nervousness, or anxiety. These side effects usually go away quickly if you lie down and rest. Tell your healthcare professional if you have any side effect that bothers you or that does not go away. Visit EpiPen.com for full prescribing information and patient information. Epi-Pen and Epi-Pen Junior auto-injectors are for the emergency treatment of life-threatening allergic reactions, anaphylaxis, caused by allergens, exercise, or unknown triggers, and for people who are at increased risk for these reactions. Epi-Pen and Epi-Pen Junior are intended for immediate administration as emergency supportive therapy only. Seek immediate emergency medical help right away. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. For additional information, please contact us at 800-395-3376. Talk to your healthcare professional to see if Epi-Pen or Epi-Pen Junior auto-injectors are right for you.
Okay, so we're going to go through the steps, but I first want to show you in each location you have, it's now in a plastic bag. We used to use the red containers and it was kind of tricky to open them, so this is a little more easier to open. And it's going to have a regular EpiPen and then the junior EpiPen. For anyone of size of 33 to 66 pounds, you'll use the junior. And then anyone larger, you're going to use the regular. And then there's also some gloves in there and your standing orders. So they have been broken up, the packs are broken up, and you'll have one junior, one regular in each location. Some are in this yellow container, like this. If you only have, most of the time, if you only have one AED, you're going to have another location that has a yellow container. And so there's actually a breakaway tab that you can just break it and open it up. It's not locked or anything like that. It just has a breakaway tab, so students don't just open it and go into it. So this is also where your NARCAN will be housed. Okay. Angela's going to help me just show y'all. These are the trainers. If you've not already used it, you're going to take off the blue tab. And then you're going to position over your, you can do it over your clothes, on, or, you know, anywhere. And then just going to hold it down at your mid-thigh for 3 seconds. You always want to make sure you call 911 if you use an EpiPen. If a nurse is not in the building, if you don't have a nurse all day long and a nurse is not in the building, please make sure you notify them so they can notify me and we can get a new one ordered as soon as possible, okay? So we do need to know that. This is used just for a stock EpiPen. So when I say that, if they have EpiPen, like an EpiPen order in the school, you're going to use their EpiPen that is specifically for them in that clinic, okay? So these are just for students that have unknown allergies. Yes, so there's also a few other epinephrine that's on the market, and you may have a student that has that. If so, the nurse will notify you and let you know, hey, we need to make sure you know how to use this if you're going on a field trip or anything like that. So there are 2 different ones. This is the it's
kind of just like a generic one.
Yeah, generic one.
Epi-Pen on it.
That's since there was
But it's a little bit different. There's 2 different knobs that you actually have to take off instead of just the one. And this one actually does have a needle that stays out. So when you pop it in, there's going to be a needle sticking out of it. It's not a never-see needle like the actual EpiPen. But this one's cheaper. So when they raise the price on the EpiPens, there's some other people, you've got a generic one basically, but it's the same medication, it's just made where the needle will actually stick out. So you don't want to make sure that you don't get stuck with that needle or stick somebody else with it after you've given it.
And then there's also the AVQ. Auvi-Q was off the market, now it's back on. And I'm not going to walk through this all because the nurse can show you, but it does automatic. It tells you how to use it.
Step by step.
Yeah. So it's pretty cool. All right. Angela is going to go over, well, actually, I'm sorry. I'm going to go over the diabetes real quick with you. Like I said, you receive the hypo and hyper signs. We are still going to do the glucagon training in your schools. This is just a basic diabetes training. Okay, so for the hands-on glucagon training, Angela will still be going to your school to do that. And then make sure, I just always want to reiterate, follow the student's 504, okay? If you have a diabetic or any other medical condition, make sure you're looking at that 504 and know what you need to accommodate them in the classroom for, okay? And then if a student has a low blood sugar, please make sure you call the nurse. Don't send them to the clinic by themselves, okay? We just need to make sure for the student's safety, call the nurse and they can come to the student. All right, so we're gonna go ahead and do there's 3 videos on diabetes, so we're going to go over those. If Marcus is up there, there we go.
The school nurse and other school staff make up a team that helps students with diabetes be medically safe and ready to learn. If you interact with a student with diabetes, it's important to know how you can help the child succeed. Your first responsibility is to know which of your students has diabetes. Every student with diabetes should have a diabetes medical management plan, sometimes referred to as the DMMP. The Diabetes Medical Management Plan is also called other names, such as the Diabetes Healthcare Plan or Physician's Orders. The plan is developed by the student's healthcare team and family and is given to the school nurse by the parent at the beginning of the school year, or just after the child is diagnosed. The Diabetes Medical Management Plan provides information about the student's diabetes care regimen for the school setting that the student, family, school nurse, and school staff who will be providing care when the nurse isn't available need to know. The Diabetes Medical Management Plan tells you when the diabetes was diagnosed, how capable the student is of taking care of himself or herself at school, has medical orders for blood glucose monitoring, insulin, and glucagon, a list of diabetes equipment and supplies, a meal and snack plan, exercise requirements, and what to do in an emergency. Knowing what to do is critical for the safety of the student, because having diabetes means that blood glucose levels can suddenly go up and down. You need to know how to recognize a student whose levels are either too high or too low, and what to do about it. We've got another module that goes into those details, but they're in the Diabetes Medical Management Plan. Finally, the Diabetes Medical Management Plan provides the foundation for the development of other important written plans. The greatest immediate danger to students with diabetes is hypoglycemia. That's low blood glucose. Remember how it sounds. Hypo, low. The other thing you need to remember is that many times hypoglycemia cannot always be prevented. Be alert for a range of possible signs that something's wrong. Different students can have different symptoms. They may be lethargic or irritable. They may feel weak or unable to think straight. They may be combative, and they may start sweating. Hypoglycemia can come on suddenly without warning. Students can get tired or start feeling ill for any number of reasons.
Test your blood sugar.
No, I'm fine.
Are you sure?
If they're doing sports, they can sweat. But if they've got diabetes, you need to watch for any change in behavior or appearance. Hypoglycemia can be unpredictable. The student's condition can deteriorate very quickly. If not treated promptly, they may have a seizure, trouble swallowing, or they may faint. Be familiar with the student's low symptoms and treatment as contained in the Diabetes Medical Management Plan, and know where to find the student's low blood glucose supplies. Fruit juice, glucose tabs, or regular soda can deliver 15 grams of fast-acting carbohydrate. Your job is to intervene and treat before the student's condition worsens. And remember, a student experiencing hypoglycemia should never be left alone.
That guy told me to pick
Hypoglycemia can come on at any time, not just during sports. Sometimes the signs are not going to jump out at you. But again, if you've got a student with diabetes, keep an eye out for the red flags. Watch to see if she's sweating or feeling weak when she shouldn't be, if she loses interest or looks pale or sleepy. Clammy skin can be another sign. But the main thing to look for is the change in behavior. A minute ago, the student was focused and looked fine. Very suddenly, though, she's lost interest, and she looks just out of it.
You have your meter in your purse?
It's in my locker, but I'll be okay.
Stay right there. I'm going to get you some juice.
Hypoglycemia can sometimes affect the way people think. So don't expect the student to know what's happening, or even be cooperative. If you don't have a blood glucose meter, treat for hypoglycemia anyway. After a hypoglycemic event, kids need time to rest and recover. Because people with diabetes don't have enough insulin, their bodies can't move glucose from the blood into the other cells. The glucose builds up in the bloodstream. High blood glucose above target range is called hyperglycemia. To help you remember, think hyper, think high. Any number of things can cause hyperglycemia. It's possible that the student has forgotten to take insulin or hasn't taken enough. The student may have eaten more than planned. Food raises blood glucose levels. Stress, inactivity, or illness can also cause hyperglycemia. Among the signs are thirst, tiredness, dry skin, and stomach pains. Also fatigue, the inability to concentrate, and frequent urination are signs of hyperglycemia. Whatever the cause, you need to know how to recognize hyperglycemia. This is important.
Hang on a sec.
While hyperglycemia should be avoided and treated in all students according to the Diabetes Medical Management Plan, which may include giving insulin, it is important to know that the onset of hyperglycemia comes on more quickly in students who experience insulin pump malfunctions. You're not expected to be a doctor, but when you have a student with diabetes and you notice that something's wrong, you've got to take action. The greatest immediate danger to students with diabetes is hypoglycemia. That's low blood glucose. Remember how it sounds. Hypo, low. The other thing you need to remember is that many times hypoglycemia cannot always be prevented. Be alert for a range of possible signs that something's wrong. Different students can have different symptoms. They may be lethargic or irritable. They may feel weak or unable to think straight. They may be combative, and they may start sweating. Hypoglycemia can come on suddenly without warning. Students can get tired or start feeling ill for any number of reasons.
Test your blood sugar.
No, I'm fine.
Are you sure?
If they're doing sports, they can sweat. But if they've got diabetes, you need to watch for any change in behavior or appearance. Hypoglycemia can be unpredictable. The student's condition can deteriorate very quickly. If not treated promptly, they may have a seizure, trouble swallowing, or they may faint. Be familiar with the student's low symptoms and treatment as contained in the Diabetes Medical Management Plan, and know where to find the student's low blood glucose supplies. Fruit juice, glucose tabs, or regular soda can deliver 15 grams of fast-acting carbohydrate. Your job is to intervene and treat before the student's condition worsens. And remember, a student experiencing hypoglycemia should never be left alone.
That guy told me to pick
Hypoglycemia can come on at any time, not just during sports. Sometimes the signs are not going to jump out at you. But again, if you've got a student with diabetes, keep an eye out for the red flags. Watch to see if she's sweating or feeling weak when she shouldn't be, if she loses interest or looks pale or sleepy. Clammy skin can be another sign. But the main thing to look for is the change in behavior. A minute ago, the student was focused and looked fine. Very suddenly, though, she's lost interest, and she looks just out of it.
You have your meter in your purse?
It's in my locker, but I'll be okay.
Stay right there. I'm gonna get you some juice.
Hypoglycemia can sometimes affect the way people think. So don't expect the student to know what's happening, or even be cooperative. If you don't have a blood glucose meter, treat for hypoglycemia anyway. After a hypoglycemic event, kids need time to rest and recover.
Anything else about diabetes? Okay. All right, so I'm going to talk about NARCAN. We put NARCAN in the schools last year, and everybody has, each school, just like she was talking about earlier with the Epi-Pens, there's a bag like this with your Epi-Pens, some of them with the AEDs, and then some of them with the Epi-Pens in here, and that's on the list that she sent you already. You will have one dose in each place. So there's 2 doses in your school, but they're separated. So you have one in each place. We'll be doing a video here in a few minutes. Catherine Brunson will be doing a certification in some of the classes, some of the breakouts that you can do. If you want to do a certification, you can do that with her, and then you can actually get a NARCAN to keep with your, at your home or in your camper or wherever, if you feel like you have some reason to need one, whether it's a neighbors or friends or family or whatever. So you can do that as well as doing this if you want to do that. The video will show you how to use these. I don't want to open this one and waste it. We will have the orders in here, standing orders for the NARCAN, as well as a pair of gloves. I know this seems a little odd to a lot of people, but most school systems are putting NARCAN in their schools. This may not be for our students. It may be for a parent or somebody in the pickup line, or it could actually be for a student who's young and got into their parents' medications or something. I've had a 2-year-old in the emergency room that they brought in basically dead, and we worked on the kid for a while before they told us they found their pain pills in the floor. So you just never know who you'll be needing it for. You may actually have to use 2 doses, but before you do anything, you want to call for your SRO. You want to call 911. If there's any help, you want to get it available. If you have to use this on a parent or a student who does use narcotics regularly, then they're probably going to be really mad when you wake them up, like very aggressive, because you've just messed up everything they've been working on. So they do come up very aggressive, and they don't feel right when they wake up, so they're combative a lot of times. So you for sure want to call an SRO before you do anything and get as much help as you can, and call 911 or have somebody do that for you. You'll do a dose in one nostril. If that doesn't work and you have to have a second dose, you can give the second dose and you can use the other nostril. I think that's about all I have except for the video, and if y'all have any questions. And yes.
Can you talk about what it actually does? Because a lot of people are afraid to administer it because they're afraid they'll cause something else.
Yeah, there's no negative side effects. If you give it, the only thing it does is the receptors that are the opioid is in, When you give them Narcan, it just pushes the opioid out of those receptors and it fills the receptors. So it only lasts about 30 minutes, has a half-life about 30 minutes anyway. So it's gonna wear back off. They have to go, you have to call 911. When they get up and they're mad and if they're able to get up and they wanna storm out, you need to go ahead and call 911 regardless, because within about 30 minutes, this is gonna wear off and they're gonna go back down, more than likely. So if it's not, yeah, it doesn't do anything else. If they have a heart attack and you give them, they're down, and even if it's a known narcotic user, you give them this, and if it wasn't that, it's not gonna affect anything else. You've not hurt them. The only thing it's gonna do is push that opioid out of the receptor, and this is gonna take over the receptor. So, yeah, while we watch the video, we're gonna take out the Epi-Pen, so if y'all just pass on to the end of the rows, we'll come by with the buckets.
NARCAN nasal spray is not a substitute for emergency medical care. As with any drug, you need to be aware of important safety information concerning its use. Please see indications and important safety information at the end of this video. Also, please see accompanying full prescribing information in the use of this product. NARCAN nasal spray is an emergency treatment for a known or suspected opioid overdose. The appropriate use of NARCAN nasal spray can help you save a life. NARCAN nasal spray is not a substitute for emergency medical care. As with any drug, you need to be aware of important safety information concerning its use. If you encounter someone who is unresponsive and you suspect an overdose, first shake their shoulders and shout their name.
Kevin.
Ask if he or she is okay.
Hey, can you hear me?
Check for signs of an overdose, unresponsive to touch or voice. Breathing is slow, uneven, or has stopped. Snoring, gasping, or gurgling sounds. Fingernails or lips are blue or purple. Administer NARCAN nasal spray as quickly as possible if someone is unresponsive and an opioid overdose is suspected, even when in doubt, because prolonged respiratory depression may result in damage to the central nervous system or even death. Lay the person on their back to receive a dose of NARCAN nasal spray. Remove NARCAN nasal spray from the box. Peel back the tab with the circle to open it. Remove and review the printed quick start guide inside the package. Hold the NARCAN nasal spray with your thumb on the bottom of the plunger and your first and middle fingers on either side of the nozzle. Do not press the plunger to test or prime the device. If you do, you will waste all or part of the dose of medication. Tilt the person's head back and provide support under the neck with your hand. Gently insert the tip of the nozzle into one nostril until your fingers on either side of the nozzle are against the person's nose. Press the plunger firmly to give the full dose of NARCAN nasal spray. Remove the device from the nostril after giving the dose. After you have given this medication, seek emergency help right away. NARCAN nasal spray is not a substitute for emergency medical care.
I'm with somebody who stopped breathing. I think they've had an overdose.
Move the person on their side after giving NARCAN nasal spray. If possible, put their hands under their head and bend their upper leg forward. This helps prevent the person from rolling onto their stomach. This is known as the recovery position. Continue to watch the person closely. If they do not wake up or respond to your voice or touch, or if they do not seem to be breathing normally within 2 to 3 minutes, use a new NARCAN nasal spray to give an additional dose in the other nostril. Acute opiate withdrawal symptoms may occur from use of NARCAN nasal spray in patients who are opioid dependent. Symptoms include body aches, diarrhea, increased heart rate or tachycardia, fever, runny nose, sneezing, goosebumps, also known as piloerection, sweating, yawning, nausea or vomiting, nervousness, restlessness or irritability, shivering or trembling, abdominal cramps, weakness, and increased blood pressure. When the emergency is over, put the NARCAN nasal spray back in its box and throw it away in a place that is away from the reach of children. In addition to watching this video, please read the quick start guide that comes with NARCAN nasal spray before using it. Talk to a healthcare professional if you have any questions about how to administer NARCAN nasal spray. Please read the indications and important safety information that follows. Store NARCAN nasal spray at room temperature between 59 to 77 degrees Fahrenheit, 15 to 25 degrees centigrade. Do not freeze NARCAN nasal spray. Keep NARCAN nasal spray in the box until ready to use. Protect from light. Replace NARCAN nasal spray before the expiration date on the box. Keep NARCAN nasal spray and all medicines out of the reach of children. Indications. NARCAN, naloxone hydrochloride nasal spray, is an opioid antagonist indicated for the emergency treatment of known or suspected opioid overdose, as manifested by respiratory and/or central nervous system depression. NARCAN nasal spray is intended for immediate administration as emergency therapy in settings where opioids may be present. NARCAN nasal spray is not a substitute for emergency medical care. Important safety information. NARCAN nasal spray is contraindicated in patients known to be hypersensitive to naloxone hydrochloride. Seek emergency medical assistance immediately after initial use, keeping the patient under continued surveillance. Risk of recurrent respiratory and CNS depression. Due to the duration of action of naloxone relative to the opioid, keep the patient under continued surveillance and administer repeat doses of naloxone using a new nasal spray with each dose as necessary while awaiting emergency medical assistance. Risk of limited efficacy with partial agonists or mixed agonist-antagonists. Reversal of respiratory depression caused by partial agonists or mixed agonists-antagonists, such as buprenorphine and pentazocine, may be incomplete. Larger or repeat doses may be required. Precipitation of severe opioid withdrawal. Use in patients who are opioid dependent may precipitate opioid withdrawal, characterized by body aches, diarrhea, increased heart rate, tachycardia, fever, runny nose, sneezing, goosebumps, piloerection, sweating, yawning, nausea or vomiting, nervousness, restlessness or irritability, shivering or trembling, abdominal cramps, weakness, and increased blood pressure. In neonates, opioid withdrawal may be life-threatening if not recognized and properly treated, and may be characterized by convulsions, excessive crying, and hyperactive reflexes. Monitor for the development of opioid withdrawal. Risk of cardiovascular, CV, effects. Abrupt postoperative reversal of opioid depression may result in adverse CV effects. These events have primarily occurred in patients who had pre-existing CV disorders or received other drugs that may have similar adverse CV effects. Monitor these patients closely in an appropriate healthcare setting after use of naloxone hydrochloride. The following adverse reactions were observed in a NARCAN nasal spray clinical study: increased blood pressure, musculoskeletal pain, headache, nasal dryness, nasal edema, nasal congestion, and nasal inflammation. See instructions for use and full prescribing information in the use of this product. To report suspected adverse reactions, contact Adapt Pharma Inc. at 1-844-4-NARCAN, 1-844-462-7226, or the FDA at 1-800-FDA-1088 or www.fda.gov/medwatch.
You guys made a mess. Yes, ma'am. Did you hear? Is there an age restriction? Do you know? There's not, my understanding is there's not a smaller dosage, so we will confirm that for you. Be sure and touch base with them so we get you an answer. Anybody else? Bless you. Bless you, Johnny. Is everybody excited to be back? No. Don't lie to me. You look at where we're standing. Don't lie to me. Feel sorry for us. We get to work year round because I have more people ask me in May, are you excited that school's out? No, because that's when we have to really, really work hard. A lot of our state reports are due and things like that. So it gets very, very difficult at the end of the year. We're very glad you're back. We're excited for a new school year. Trying to get you prepared. So my name is Anna Hurt. I do coordinated school health. I'm the person that comes in and terrorizes you with flu shots and things of that nature and make all the kids cry because we don't do flu mist. So So what we're going to do now is we're going to do a couple of videos on AED. Catherine has a list of where your AEDs are located. How many of you participate on the school safety team? By a show of hands. Anyone? Julie? Perfect, perfect. And how many of you are currently CPR certified? Ah, that's awesome. So if you are interested in becoming CPR certified, please have your principal reach out to me. I can help get that training to your school. So what we're going to do is we're going to start off with a little entertaining AED video, and then we'll go into the training video.
Hello and welcome to video 3. In this video, we will learn everything AED. Let's get to it. AED stands for Automated External Defibrillator, and they are very easy to use, and to show us how, here is the AED Walk-On.
Today we're talking AEDs. These things you can work in 3 easy steps. That's right, 3 easy steps. The first one, turn it on. If you forget anything else, just turn the thing on. Number 2, put the pads on. Number 3, follow the prompts. That's right, from then on, it'll tell you what to do. If the person needs a shock, it'll light up. You'll press the button, shock the person. If it doesn't, it'll tell you no shock advised, and you'll continue CPR. Look at how amazing these things look. Can you imagine that thing just hanging on your wall in your home, your office, place of work, whatever? That's right, you can have this machine.
Okay, enough with the sales pitch. Let's take a look at the steps. Step 1. Turn it on. Turn it on. Step 2. Put it out, put it out, put it out. Say clear. It's a shock button. And if there's no response, then continue that. And every 2 minutes, we'll do it all over again. That's it.
Boom, that's it.
Okay, let's talk some special considerations. Medication patches, take off and remove gel. Hairy chest, shave or wax off. Water and electricity equals bad. Person with the pacemaker.
You got that person with the pacemaker up here? Instead of putting it right here, just move it about an inch away.
Piercings, no bother. A few more things. Adult pads okay to use on everyone. Child pads use on 8 years or younger. Infant pads are key, use only on infants. 2 or more people.
If 2 or more people work together.
Stand clear.
Oh.
Buttons to deliver
Press
shock.
the button.
And keep going until those 6 reasons happens from the previous video.
And that's how you get it done.
Every year, thousands of people die of sudden cardiac arrest.
She's unconscious. Go to the front desk, call 911, and bring me the AED.
Following the links of the cardiac chain of survival can help save lives. The sooner 911 is called, the sooner advanced medical care will arrive. Early CPR helps circulate blood that contains oxygen to vital organs. Most people experiencing sudden cardiac arrest need an electrical shock called defibrillation. Continue CPR until an AED is ready to use.
12, 13, 14, 15.
An AED, or Automated External Defibrillator, is a portable electronic device that analyzes the heart's rhythm and determines if an electrical shock is needed to help the heart restore an effective rhythm. Most AEDs can be operated by following these general instructions. Turn on the AED. The AED will tell you what to do next.
Press pads firmly to patient's bare skin.
Make sure the person's chest is bare and dry. Use a cloth or gauze pad to dry the person's bare skin where the pads will be placed. Remove the pads from their packaging. Carefully peel off the backing from one pad and place the pad on the upper right chest. Place the other pad on the left side of the chest. Plug in the connector to the AED if necessary. The AED should start analyzing the person's heart rhythm.
Analyzing heart rhythm. Do not touch patient.
Analyzing.
Do not allow yourself or anyone else to touch the person while the AED is analyzing.
They're in shock. Move away from the patient.
Make sure that no one, including you, is touching the person.
Press red flag flashing button to deliver shock. Shock delivered. It is now safe to touch the patient. Start CPR.
After a shock is delivered, or if no shock is advised, give about 2 minutes or 5 cycles of CPR. When 2 minutes have passed, the AED should automatically begin to reanalyze the heart rhythm and will advise you with a prompt to stay clear of the person.
Do not touch patient. Analyzing heart rhythm.
Continue to follow the prompts of the AED and provide care as needed.
It is now safe to touch the patient. Start CPR.
If at any time you notice an obvious sign of life, such as breathing, stop CPR, maintain an open airway, and monitor for any changes in condition. An AED can also be used for children and infants who are not breathing. Use pediatric pads if they are available. Operate the AED and apply the pediatric pads to the child's chest the same way you would for an adult.
Do not touch patient. Analyzing heart rhythm.
Analyzing. Everyone stand clear.
For a small child or infant, the pediatric pads may be too large to fit on the chest without touching each other. You may need to attach one pad on the center of the chest and the other on the back between the shoulder blades. Here is how you would work with a second trained responder when using an AED. One responder continues CPR while the other prepares the AED. This is another example of how CPR and an AED work together as links in the cardiac chain of survival. One responder continues CPR while the other attaches the AED pads and operates the AED.
Do not touch patient. Analyzing heart rhythm.
Everyone stand clear.
Preparing shock. Move away from the patient.
Shock advised. Everyone stand clear.
Press red flashing button to deliver shock. Shock delivered. It is now safe to touch the patient. Start CPR.
1 second, huh? What we're going to move into, does anyone have any questions on the AED? Please understand, if you're administering CPR, you have to have a good, firm arm. A lot of people, you'll see them bending the arms. You have to push the sternum, which is this upright bone here, hard to compress the heart. So know that when if you are doing CPR. If you don't want anything to do with this, you can still be help. You can stand and watch for the ambulance. You can help clear students into another classroom, things of that nature. So don't think that we're forcing you to do AED, but we want you to know where they are, and we want you to know that they're available. We have saved people's lives in this school district as a result of having these AEDs. So, does anyone have any questions? Anyone? Because we're going to quickly move into, I wanted to expose you guys to trauma-informed training. This is a really quick, brief overview of kind of some of the behaviors you may see in students. All of us will experience some of these. We're talking more and more and more about adverse childhood experiences and what happens with those. People that live in households with a lot of trauma will cope with that in different ways. So I apologize for reading this, but this is what the state really wants us to get through to you guys. The future prosperity of any society depends on its ability to foster the health and well-being of the next generation. When Tennessee invests wisely in children and families, the next generation will pay that back through a lifetime of productivity and responsible citizenship. Early experiences literally shape how the brain gets built, establishing either a sturdy or fragile foundation for all of the development and behavior that follows. A strong foundation in the early years increases the probability of positive outcomes. This presentation will explore how adverse childhood experiences harm developing brains and bodies of children, comprising the foundation for lifelong health. The adverse childhood experience research has resulted in child abuse and neglect being acknowledged as a major public health problem and leading cause of early death. From academic failure to alcoholism, from crime to cancer, presence of adverse childhood experiences comprise the safety, tax dollars, and quality of life for all Tennesseans. This presentation will also identify community-based strategies. This one kind of won't, because we're not getting into it. It is a couple hours long. But we can do that at your school. Please know that I will come to your school and present this. Community-based strategies to prevent and mitigate adverse childhood experiences and build resilience. As you know, we've had Project Aware, which is our mental health grant, for several years now. That is the focus of Project Aware, is to build resilience in our students. Understanding the adverse childhood experience research deepens professional knowledge across all sectors and creates a common language for collectively addressing community challenges. So we're ready to go ahead and start the, oh, you're so awesome, PowerPoint. Next slide, please. So as we work to change the culture of Tennessee so that the state's overarching philosophies, policies, programs, and practices for children, youth, and young adults utilize the latest brain science to prevent and mitigate, meaning prevent, the impact of adverse childhood experiences. So the overarching message from science is clear. How children develop early in life matters for them and for all of us. Healthy child development is the foundation for educational achievement, economic productivity, responsible citizenship, and lifelong health. These are the pillars for successful parenting of the next generation, which ultimately result in strong communities and a healthy economy. This is not just an opinion. It comes from neuroscience, molecular biology, genetics, behavioral and social science, and even from economic analysis of human capital development. What all these sciences tell us is that healthy development in the early years means children will be more successful in school, and as adults, they will become more productive contributors to the economy, more responsible participants in their communities, and lead healthier, longer lives. So, think about this. If you're building a home, what is the first thing that you need to make sure that that home is going to last many, many years? Strong foundation. That's exactly right. So the early years are so critical because if you have cracks in your drywall, roofing issues, things of that nature, the floors aren't level, what are you going to have to do? You're going to have to go back and redo some of those things to make that structure stable. So, just like building a home, the earliest years of life lay that foundation for all future brain development. If a foundation is laid poorly, we may see symptoms develop later in life, such as addiction, disease, academic problems, and oftentimes we see incarceration as a result. We see a lot of behavioral issues as a result of this. Getting things right in the beginning really sets the stage for a good foundation. So in early childhood, we reference this as a serve and return relationship. When you see a mother and a small baby, what do you generally see in a healthy relationship? The mother makes faces, they coo and they aw, and they go back and forth, much like a tennis match. So it's referenced as serve and return. That really helps with brain development. The serve and return works best within a trusting relationship between a child and adult who is responsive to the child's own unique individuality. And boy, don't we have those. You can't hear me? Can you hear me now? I'm sorry. You would think you could hear me, of all people. Thank you for telling me that. These mutually rewarding interactions are essential for the development of a healthy brain circuit and increasing complex skills. So think about that. If I grew up in a trauma household, I'm more worried about what's going on, and I'm not really focused on what I've came to school to accomplish. Does that make sense? All of us see these children and can intervene at some point. All they need to know is that we care about them. And that's where our mantra of every student every day comes into play, because we mean that. The most important relationships begin in the family, but often also involve older adults who play important roles. I think we all have that one teacher or that one daycare provider that we still to this day think about. Miss X or Mr. X just meant the world to me. Those are the people that help shape and mold us. A lot of times it is the school nutrition person, it is the custodial staff. It's not us. You guys see them each and every day, and you know when these kids are having issues. Next. So, not all stress looks the same, and not all stress is toxic. So we need to delineate that. When you look at the first one, it talks about positive stress. That's what we have today. I want to say this is positive. We're here doing some really great things. We may be a little stressed, as I am, talking in front of a lot of people. It is not my forte in life. It's positive stress. So what that means is that helps the brain develop that resilience, that I know that I'm going to get a flu shot, or I've got to start a new school, or I have new schoolmates. Positive stress is short and includes stressful events that help the development. The second one is tolerable stress. I know death in a family a lot of times is crushing. We know that. But those are life events. And those are things that we can expect to happen. They're unavoidable. It includes things like losing a loved one or experience a frightening injury. The key here is that the child has a supportive caregiver or caregivers to buffer that stress response. This keeps these events from doing lasting damage to the brain and body. And then we have the last one, which is toxic stress. It is ongoing, repeated exposure to abuse, neglect, or household dysfunction. It is bad for the brain development. If no one connects with this young person to help buffer the stress response, we start producing chemicals in the brain, the fight or flight, cortisol, things like that, that damage us physically and mentally. Next. So you think about, especially how many, do I have, oh, this is all elementary, right? So you think about it, when they get to 5th grade and they're getting ready to transition to middle school, it's kind of like air traffic control. Did you turn your homework in? Did you remember this? Did you bring your lunch? Did you bring your backpack? How often do you see those parents running in, bringing stuff that these kids can't remember? So you think of all this information flowing at these young people, and they're trying to hone it all in. It's much like an air traffic control system. So it's part of that executive functioning that is developing as they get into middle and high school, that we have to help them as an air traffic controller make sure that no planes crash. Next. Oh, we're going to watch a quick video maybe, hopefully. I love you forever, Marcus. You may or may not be able to get this guy. Thank you, sir. If I come to your school, you'll get to see that video. So, maybe? Okay, we can move on. Thank you. So, what we're really looking at is adverse childhood experiences and what they impact. So when you look at how they impact young people and adults, or how they manifest in adulthood, They can manifest as obesity, diabetes, depression, even attempts of suicide, sexually transmitted diseases, heart disease, cancer, and so forth. You see a lot of behaviors, and you see them a lot in elementary school. A lot of times they are reaching out. Think about the frequent flyers that you have, and sometimes you can tie that back. Next. So when we look at Tennessee in general, not the United States, but Tennessee, every time that you identify an adverse childhood experience, you see on the right-hand side, 27%, and this is as of 2016, that 27% of the respondents to this survey had 3 or more adverse childhood experiences. That's 1 in 4 people that responded to this had 3 or more. That is huge, because everyone compounds some of these issues that onset later in life. Next. They have added new things. The conventional adverse childhood experiences, as you see, are a lot of those that we already know all too well, unfortunately, but we've also expanded it. Witnessing violence, if there's violence in the home, living in an unsafe neighborhood, experiencing racism, foster care. We have a lot of children in this district that are in foster care, a lot in Tennessee, and bullying, and we'll talk a lot more about bullying. Next. Next. So it's the thing that we've been focusing on. Our schools are a safe, nurturing environment, and we want to keep them that way. Next. So when you look at the red line, if we do intervention from, say, when they start Head Start or kindergarten, look at how it goes down. If you look at the one on the right, that goes up. That means how much money we have to spend on intervention programs to try to correct some of these foundational issues. Next. So what we're doing now through Project Aware is we adopted trauma-informed school policies. We're doing a lot of home visiting. We're trying to integrate healthcare, and we're providing high-quality access to affordable childcare and pre-K. We have supportive businesses that are supporting us, and we also have a lot of support for teen pregnancy. Next. We're providing access to mental health. We're working with our partner agencies on partner violence prevention. And unfortunately, we've had a lot of rural health closures, but we're also working diligently to provide access to health care in Tennessee, especially in the rural areas. Social support for parents. You know, we have our social workers, and they are helping to bridge that gap. We have incredible community support, and we're trying to provide good support for low-income families to access all of these services and resources. Next. It's a little busy. We'll go next. I want you to walk away with one thing today, if nothing else. We need to change our way that we address our students from what is wrong with you to what's happened to you, because that's when the intervention really comes into play. Generally, behaviors are a manifestation of something going on at home. So if it's a negative behavior, we want to intervene and provide them the support and help them build the resilience. That may be it. One more, maybe? And if you need further information, I can provide that. I can come to your school and talk about this a lot more. But I really appreciate your time, and I hope you're off to an awesome start today. And Mr. Wade has something to say. Thank you all so much.